A new report shows signs that adolescent mental health has improved, but still remains a crisis, especially for girls. The Centers for Disease Control and Prevention tracked weekly emergency room visits among kids aged 12 to 17 for suicide attempts, other suicide-related behaviors, and drug overdoses. And by the fall of 2022, visits for those conditions were each 10% lower than they were in the fall of 2021. But despite the decline, emergency room visits for other mental and behavioral health issues remained at or higher than pre-pandemic levels for teen girls. Drug overdoses are also higher than pre-pandemic levels. Those involving opioids increased 27%, with greater increases among teen boys. Mental health counselors will be available starting in the fall at Hopkins County schools. It's a new initiative that's grown out of a concern, or what some are even call a crisis, over the mental well-being of our kids. And joining me now to talk about this is Hopkins County School Superintendent Amy Smith and the Director of Assessment there at Hopkins County, Dr. Andy Belcher. Thank you both for being here. Welcome. And let's talk about this. What drove Hopkins County to the point to add this program, this initiative?
Well, we currently see the needs of our children and our staff as well changing, and especially after the pandemic, the needs have changed with what they went through during that time when they weren't socialized and with their peers or with their teammates at work. So with that, we not only educate academically, but we have to look at the whole child. Right. And with that, this is a huge priority not only for us, but for our board members. And they have just listened to our concerns, and they're very supportive of these needs.
You mentioned the whole child, but I would assume that a child really can't learn if they are within a mental health crisis themselves.
That's correct. You know, when we have our children, we always say to them, not only the ones experiencing these struggles, but our students who are their friends, we always say, when you see something, say something. And that is so important right now, that we are there to know and to be heard, that our kids know that it's not a sign of weakness, it's truly an illness. And so what we want to do is stop the stigma, and we want to help support that medical need that is a mental need, and provide them with resources to help them get well and provide treatment during this process.
Now, I know one thing you said in your release is that you want to make sure that the parents and the kids realize that it's okay to ask for help. Mm-hmm. Talk about that. Why is that so important? Dr. Belcher.
Well, one reason that it's important, we see mental health very connected to school safety. Yeah. And there's been a lot of incidents lately around our country that are tragic, and there's just a huge connection between student mental health and school safety. And so one of the priorities that our board and our superintendent and all of us in Hopkins County Schools take very seriously is student safety, and making sure that kids are safe in school, and as you talked about, coming to school ready to learn.
Right.
So we really feel like that this gives us an advantage in being able to provide the best possible education for all of our students.
And that's the best thing for them. It's not a stigma. Everybody goes through it at some level.
That's right.
But they need to understand that. Well, Dawn, let's talk about the plan, this new initiative. What do you hope to do?
So currently, we have been working in a partnership with a mental health facility in our community. And so what we saw was that, like everybody, there are staff shortages, and that is a need in not just our school system, but it's a need in private sectors and industry. So we saw that there was a lack of consistency with staff shortages. So what we wanted to do is hire our own, and so by doing that, we can hold them accountable. We also want them to have the same values that Hopkins County Schools is so proud of, and that we exemplify every single day. And by doing so and having that consistency and them feeling a true part of our team, we're hoping that we can work together and provide the best education and support their needs as possible.
I asked you before, how many schools are in your district there that we're talking about?
So we have 15 campuses. We have actually 13 A1 schools. So by that I mean our elementary, middle school, and high schools, and then we have 2 alternative programs. So in those A1 schools, we would want to hire a mental health counselor for each one of those buildings. And so then that just helps our families as well, because the students don't have to leave school to go to an appointment. It helps parents who are working, parents who have limited means of transportation. So it really does help support parents at home who are having a hard time, and we want to make sure that our students miss as little of the school day as possible. Right. So by having this available on campus, it's very helpful.
I would imagine too they would build a relationship with those students, which would be so helpful too.
Yes.
Let's talk about, this is, I understand, a grant. You actually wrote the grant. Where's the money coming from, and how much are we talking about here to do this?
Well, the most expensive resource you can have is a human resource, so it's not an inexpensive endeavor. We did write a grant through the Kentucky Department of Education. Actually, the state legislature allotted a significant amount of money, in particular for the districts that were affected by the tornado from December of 2021, and the specific grant that we received funding for to begin this initiative came from that grant. We'll also seek other grants as this one expires, but I also want to point out too that the board has been so committed to this that regardless of grant status or not, they see the need, and they see that it's so important to our families and our students, and as Ms. Smith said, our staff. So we're going to be able to make this work no matter what.
That's fantastic. And you know, you just pointed out the tornado and the pandemic. There's so much that our kids have had to deal with.
Sure.
So this is a great step in the right direction. Thank you so much, Superintendent Smith, and also Dr. Belcher, for being here today and talk about this great new initiative at Hopkins County Schools starting this fall, correctly?
That's correct.
Okay.